started.
Hello, I am Dr. Soumya, one of the doctors in Postnatal Clinic today. May I confirm your name and age, please?
Yeah, I'm Kitty and I'm 30-year-old.
How would you like to be called?
Kitty is fine.
Okay, Kitty. I have gone through your GP letter and I understand that you have delivered 6 weeks ago and you have some problem with your waterworks. Am I right?
Yeah.
Okay. So apart from this, do you have any other concerns or expectations from today's consultation?
Yeah, I do have few questions, but firstly, I wanted to know why these problems I'm having. Then I will discuss what I'm worried about.
Surely, I will come to that, Kitty. So before that, is that okay if I ask you a few questions?
Yeah.
So could you tell me more about your problem in your own words?
Yeah, doctor. Actually, I delivered 6 weeks back. After the delivery, there was some pain, and then I was finding it difficult. I used to go to urine frequently. Eventually, the pain has decreased, but now after 6 weeks, I have noticed that I keep on passing small amount of urine. My tummy is also growing big, and I do leak somehow sometimes. So I'm really worried and upset about it.
I'm really sorry to hear all of this. Kitty. Definitely, we are here to help you. But did your bladder feel empty at the end of passing urine?
I do not know, doctor. I need to go quite frequently, and I just pass small amount.
Okay. Uh, okay. And I also see that you do you have any sensation that you want to pass urine?
Yeah, I do go.
Okay. How was your stream of urine? Was it very thin or is it normal?
Yeah, it's normal, but then I pass very less.
Okay. Okay, Kitty. So, apart from this, do you have any pain in your tummy or down below?
No,
Any bleeding?
no,
Any discharge from down below?
no.
Um, do you have any burning sensation or pain during passing urine?
No, doctor, just now I told you.
Sorry. Do you have fever?
No.
Are you breastfeeding your baby?
Yeah, I'm breastfeeding my baby. My baby is quite well.
Okay. Okay, Kitty. So, can you tell me more about your pregnancy? Was it smooth? Your
Yeah, actually, this was my first pregnancy. Things were pretty normal. Everything was going well. And at 41 weeks, actually, I went into spontaneous labor also. But my labor was a little bit prolonged, and I was really exhausted, tired. So they had offered me epidural also. And I pushed, and then the baby was not coming down. So they had offered me forceps.
uh, okay. So, do you have a cut below in down below?
Yeah, yeah, yeah.
Was there any excessive bleeding after delivery?
No.
So, do you know your baby's weight?
Yeah, the baby was around 3 kg.
Okay. Oh, so okay. Okay, Kitty, do you have any other medical illness?
No,
Any surgeries in the past?
no,
Any allergies?
no.
Okay. Um, how was your support at home?
Yeah, me and my husband both are very well supported by our friends, by our recent family, close-knit family. So nothing to worry about it.
So, how are you feeling as a new mom?
I'm
Uh,
happy, doctor. I'm happy, but these problems are troubling me a lot. And it is taking my attention. I cannot pay attention to my baby.
um, I'm really sorry. I will come to that soon. Okay. I'm really sorry. I'm sorry to ask that. Have you resumed your sexual activity after delivery?
Not it.
What are your future pregnancy plans?
Yeah, that is also keep me worrying actually, doctor, because if such kind of problems are going to happen repeatedly, I don't know about my future pregnancy. I wanted to have babies.
Okay, Kitty. So, thank you for all the information. Is that anything else do you want to add?
No, no, no.
Kitty, I would like to examine you in the presence of chaperone. Is that okay with you?
Yeah,
I would like to examine you in the tummy to look for any swelling or pain in your tummy, and also I would like to confirm that your uterus has returned to a normal size after delivery. Also, I would like to examine your from down below to look for your wound has healed well. Is there any pain or swelling in or any other signs of infection? Okay.
okay.
Uh, okay, Kitty. So, with all the your history and examination findings, you are having a condition known as a postpartum voiding dysfunction. Have you heard about that?
No, doctor, is this something to worry about?
No, Kitty. It's a very common condition after delivery. In this condition, women usually find it difficult in passing urine, and some women may not pass urine at all. It usually occurs in 14 to 24% after delivery. The good thing is that it is a treatable condition. If treated promptly, you can pass urine on your own. Are you with me?
Yeah,
Okay. Regarding the cause, actually, exact cause is not known, but there are certain risk factors, um, like women who are delivering for the first time, who had a prolonged and difficult labor, and who had opted for a epidural, and who have those who had an instrumental delivery or any perineal tears or cut in the perineum called as an episiotomy, or sometimes it may be due to the hormonal changes during the pregnancy as well. Are you with me?
yeah.
Okay. So, so regarding the management, I would like you to offer some test. First, I would like to insert a catheter into your bladder to know about the
Hmm.
volume of urine remaining in your bladder. Or we may also offer you a bladder scan to know that amount of urine remaining at your bladder. So depending upon the volume of urine in your remaining in your bladder, the management will depend. If your residual urine volume is less than 150 ml, there is nothing to worry. You can attempt to bleed after 6 hours. But if it is more than 150 ml, but within 700 ml, we would like to keep a catheter for another 24 hours. And after 24 hours, we will remove the catheter and you can attempt to voiding later on. And but if the volume of urine is more than 700 ml, we may need to place the catheter for 2 weeks. And we will fix an appointment after 2 weeks so that we can reassess you later on. Uh, am I clear so far?
Okay. Okay, doctor, I got it. With this, what next, doctor? If okay, let it be. Means I need to undergo this procedure. But what next?
Yes, but you may also go home with the catheter as well. I will arrange a nurse to teach you about the catheter care as well. But you may need to be aware of the warning signs like fever, pain in your tummy, or any kinkage or blockage in the tube. You need to contact us immediately. If
Yeah, definitely, definitely, doctor. I will be contacting you. But is it means why? I mean, it's because of this postpartum voiding dysfunction I'm leaking.
yeah, because of the things happening around your delivery, the bladder tone is a little weak, so that the bladder cannot hold urine as previously. So that, and also that's why you don't feel the sensation to void. So it cannot hold. After a certain point of time, the bladder will start to leak because your tone, the bladder is little underactive because of
Okay. Is
this.
it a permanent type of injury, doctor?
No, with this, with the catheterization
Extra
and
2 minutes, I'm giving it to you, okay?
with catheterization and physiotherapy, usually it will settle down. But sometimes, very rarely, it can lead to a permanent, lifelong urinary problem like painless urinary retention, and you may need a lifelong catheterization in very rare situation. I don't mean to scare you, but I need you to inform this.
It's okay, doctor. So this means if I go for cesarean section in my next pregnancy, will this be avoided?
Uh, yes, you may consider cesarean section, but usually this has nothing to do with cesarean section. Altogether cannot prevent this because it may occur due to the hormonal changes also. Cesarean section altogether cannot nullify this problem.
Okay. Okay. Yeah, doctor, that's it actually. And any medications for this, doctor?
Yeah, there is certain medications we can advise you to increase the tone of the bladder as well. We will
Okay.
connect you to gynecology specialist so that he will follow up you with.
Okay. Okay.
I will provide you with the patient information, written information as well. I will document today's consultation. I will inform our consultant as well. Since
Um,
this is a difficult time to handle, I will also put you in touch with the counselors.
oh, thank you, doctor. Thank you.
Thank you, Kitty.
Yeah, that's it. Okay. Finished, huh? 2 minute extra. Okay. Now your own feedback, dear. Well, you were nervous in the last 2 3 minutes. Okay.
Uh,
Your own feedback. Have you prepared this station, this task?
yes, ma'am, I have prepared, but somehow I.
This will happen. This will happen. Relax. Take deep breaths. Okay. So your own feedback. You started on a very good note.
Ma'am, I think actually some information is given in the GP letter as well, but I kind of repeated that same information. I keep off asking.
Yes, a big, yeah, definitely. Very good identification. You were repeating the information, whatever has been given.
Um, then I think the history taking is too long,
Too
ma'am.
prolonged, too prolonged. Very good. Identification of own mistake is very important. Then only you will able to improve on your own presentation.
Uh,
Okay. Anything else?
and actually, and management part, I didn't cover most of the points, ma'am. Uh,
Because you were not having time, and that's the reason then you were getting nervous in spite of I gave you a time. Then this okay was another killer in your things because you were using those sentences quite frequently. And when you started explaining me the risk factor, every risk factor has one sentence, every risk factor has one sentence. So if you are going to do this in the exam, your time will not be sufficient. Okay, uh you will not have adequate time. The time will run off out of your hand.
yes, ma'am.
Okay, so you, whenever I will be put it into the YouTube, just listen. You were using the risk factor like the woman who have epidural, the woman who have forced delivery, the woman who are having a prolonged labor or primary gravida. So I would have said in this case, um, yes, we are diagnosing this condition as postpartum voiding dysfunction. Have you heard about this? No, it's quite common. 10 to 15 out of 100 women are experiencing a bladder symptoms post delivery, especially a woman who had and who are primary gravida, a difficult prolonged labor, epidural analgesia, and a operative vaginal delivery. associated with episiotomy. So these are the risk factor associated with this.
Okay, ma'am.
Okay. So a one sentence has completed whatever information you have to impart to the role player.
Yes,
Hmm?
ma'am.
So this is what is my I had mentioned. The information has been given regarding breastfeeding. The information regarding the bladder was full that has been given. Okay. So these all things has been given which you repeated here. So you could have just acknowledged that you acknowledged in the beginning. Then I don't know why you forgot to acknowledge that. You do not need to go in that detail, dear. Okay. He has mentioned most of the points and which is pointing you out towards a PPVD. So I would not have gone in detail and digging into that. I had told you that initially there was pain, but now there isn't any pain. Dribble, frequent urination, basically I'm not able to understand whether it is a frequent small urine or whether it is an incomplete evacuation. I'm not able to understand. So that's the reason, yes, examination and catheterization is must. Okay. So that history again, you went into the too much of detail. I find it out that, and there you lack your time. Your examination including history taking took you 6 minutes 30 seconds,
Okay,
and that
ma'am.
is a big, yeah, that is a big thing. But rest of the things you had managed well. Rest of the things you had managed well, because you thought that you are not having time. You missed out on important points in the management. This is one of the common and the most easiest task if somebody asked me. Okay, any props has been given. Please ensure that you will see the props and at least make an effort to ask something regarding that prop. Okay.
Okay.
So let's go through my answer. Okay, this is only means, see, you know the answer, you know everything. It is only the time management, acknowledging the information, whatever has been given to you, rather than repeating that information and taking detailed information. Okay, which is very important here. Previous similar episode, you missed out on that. Okay, any previous similar episode of retention or urinary complaints, any history of bladder catheterization, this could have been the closed question, which means I was expecting these questions. Okay, so introduction was good. Situational awareness was good there because you had aim, and while discussing the aim, you mentioned that the GP has mentioned that you are experiencing some problem with your water work. But yeah, you had a you had a forceps delivery. Could have also acknowledging that information could have been better, but it's okay. No worries. So we are here to discuss the plan, and for that I need to ask you certain relevant information. Any specific concerns or expectations? I do have multiple concerns as of now, but here my concern is why I am having this dribbling. I am getting worried about that. Okay, so that is my thing. Open question about bladder symptoms. You asked me pain, frequency, retention, incomplete evacuation, post delivery urinary problem. This you missed out. Okay, did you experience similar kind of problems during immediately after the labor, fever, vaginal discharge, any similar complaints in the past? This two history you had missed out, dear. Okay. Open history about pregnancy you asked, but I will say here labor also you can ask her in the same question. So can
Okay.
you just tell me in detail about your pregnancy and labor detail, and access that detail is very important. Hmm?
Okay.
So have you named the baby? If you think that the lay examiner is there, please ensure you will ask. Okay. If lay is not there, you can just skip out this question. And she's already breastfeeding. Please acknowledge that. Okay. I am sorry for your difficulties. You acknowledged me. Okay. You acknowledged my difficulties. Okay. Any concerns with bowel? Any bleeding? You didn't ask me regarding bowel, but you asked me regarding bleeding. Uh, Breastfeeding. You asked me. Otherwise fit and healthy. I skipped surgical history because see, I don't think there is any need for surgical history. That's the reason I skipped it, because very crystal clear it has been given, or it has been seen that it is mostly a PPOD. Social history basically only supporting well. No need of asking smoking, alcohol, and recreational drugs. Max to max caffeine and drinking habits you can ask. Mental history is very important. Breastfeeding acknowledge. Examination is needed in this case. Offer urine test, catheter to see bladder volume. which you had offered me. Okay, either catheter or a scan, bladder scan, to see the volume of urine in your bladder. Now, draw and explain her what is PPVD. Checking knowledge, yes, very nice. Acknowledge difficulty of passing urine. Hmm? So you explain me. So what is PPVD? So this is one of the common problem which many women experience after the delivery because of many reasons. Delivering for the first time, prolonged labor, epidural, forced delivery, episiotomy. It's common. How common? It is 10 to 15 out of 100 women may experience. Reassurance. Do not worry. This is treatable. Do not worry. This is treatable. Okay. This is treatable.
Ma'am, you are not audible, ma'am. Ma'am, ma'am, we couldn't hear you, ma'am.
Ma'am, you are not audible, ma'am.
Yes. Sorry, dear. There were disruptions in the network. Hello.
Yes, ma'am, now you are audible, ma'am.
Now I'm audible. Okay. Thank you, dear. Okay, so reassurance is important thing. Now what next? So it is treatable. What next? We are going to send urine routine. You mentioned. What about urine culture? You didn't mention. Bladder scan and catheter you mentioned. Okay. To rule out urinary tract infection. For what you are suspecting this? You have to mention to rule out urinary tract infection, and we'll start you on antibiotics, which will be baby friendly and safe. What we do in PPVD? We do start antibiotics. Yes or no? Yes. Yeah. Why I am dribbling? It's because of the PPVD or postpartum voiding dysfunction, prolonged labor, over distended bladder. Okay, so the bladder tone goes off. Okay, there are because of all these factors, but it can be brought back with the help of pelvic floor muscle exercises. Do continue eat. I am going to refer you to the physiotherapist. I had mentioned this in the next part. How you are going to treatment. So now depending upon the bladder volume, urine volume, it is not residual volume. So what is residual volume? It will, don't you think I will be taking it as a jargon? What
Mm.
is this? What is residual volume? So basically, it's a volume. Okay. So once you had passed urine, we will see the amount of urine in your water bag, and depending upon that, we will offer you catheterization. If it is less than 150 ml, then we will we will be watching you for the next void. If it is in between 250 to 700 ml, then a catheter will be put for 24 hours. And if it is more than 700 ml, then we are going to offer you catheterization for 2 weeks. Meanwhile, we will be asking a catheter nurse or incontinence nurse to have a look at you and will teach you bladder care and catheter care. If at all the symptom persists, then we will take opinion from the urogyne and will teach you CISC, that is clean intermittent self catheterization, and we'll need to evaluate you further for any other reason. We need to rule out any other reason. Okay, so 3 4 simple sentences we could able to finish it off this type of information. You can go home, as I had mentioned earlier, you can go home with with catheter in bladder. We will teach you how to take care of catheter. Meanwhile, catheter nurse will teach you, will be in touch with you. Drink plenty of water and citric fluids to prevent urinary tract infection. We will start you on baby friendly antibiotics for a week. Physiotherapy for strengthening of pelvic floor muscles is very important. For that, I am going to refer you to the physiotherapist. Okay, so basically this is a chart. Okay, this is a chart where in between 150 to 250 actually we have to see. Less than 150 ml we need to rule out why there is any reduced volume. Okay, will this affect my chance of having another baby? Do not get scared. Here I am really actually scared about my next pregnancy. So here you can just offer her emotional support because she is traumatized. So do not get scared of this. If you are getting affected emotionally, then we can offer you counselor support group of similar complaints like bladder and bowel community website. Regarding chances of having similar complaints during the next pregnancy, uh, unfortunately, yes, sometimes it may recur in the next pregnancy. But if you continue to do pelvic floor muscle exercises throughout, the chances of getting it is very less. Here, you have seen it, how I had mentioned. I had not given her a false information. At the same time, in a very positive enforcement pattern, I had mentioned, unfortunately, it may recur in next pregnancy, but ways are there to minimize it. We all know that pelvic floor muscle exercises will strengthen our pelvic floor, and this kind of bowel and bladder dysfunctions will be minimized. So please do it. Again, you can emphasize. So do it. Is there a permanent injury to my water work? Less likely. Okay. It's not because of any injury to your water work. With the help of pelvic floor muscle exercises, the strength in your water bag will come up. Hmm? Should I not have a cesarean section next time? It's having We do respect your choices, whatever choice you will be. The sentence what you used here, I didn't like, and at that time you were actually getting scared, and what you may consider going for cesarean section. Rather than that, we will respect your choices, whatever means whatever you want we will be offering you. But cesarean section is associated with its own pros and cons, and means this urinary dysfunction or for a ppvd, it is not recommended. Okay, we respect, but for the prevention of urinary retention, we do not recommend it. Hmm? There are multiple risk and pros and cons. If you wish, I can discuss it in detail. You can ask, because you are not having time, so you cannot discuss it. Are there any drugs I can take? And will these affect breastfeeding or my baby? Baby friendly medications will be offered to you. For that, we will be referring you to urogynecologist, and also the antibiotics whichever we are prescribing is baby friendly. Long term implications are there: repeated episodes of similar complaints, chronic UTI, stones due to retention, and sometimes a long standing hypertension also. Hypertension rather than high blood pressure will also be there. Okay, so now what? Contraception, breastfeeding, PIL or PPVD, and documenting her care and discharging her to the primary care with catheter, in continuation with catheter care nurse, physiotherapist, and GP will be in the loop. Coming to the domain wise scoring, establish patient's identity at the start of task is patient safety. Chaperone at the examination, patient safety. Assure her implication for the next pregnancy. That means reassurance basically. So less likely it will be recurring, but we are not going to completely say no, it's not going to happen. So that is a false reassurance. Allay anxieties about delivery and CS. If any drug used, assure her about the safety of breastfeeding and the baby. Whenever you are using any medications in antenatal and postnatal period, please ensure safety. uh, so information gathering basically, analgesia, catheterization after delivery was one of the important information you had to take, do it. Perineal trauma and repair, you asked me. Previous bladder problem, you missed out. History of pelvic pathology, ultrasonography in pregnancy. Okay, so you offered me a bladder scan, so I will take it that you had offered me ultrasonography. Examination you had offered me, investigation you had offered me. You didn't offer me culture sensitivity, you offered me only routine. Okay, ultrasound scan. Okay, you had offered me. I will pass you. I will not have any issues while passing you, but still, you need to manage your time. If whatever we had discussed, if it will be within that 10 minutes time window, you will definitely pass this station. It is one of the easiest station. Okay. Licensing with other specialists is physiotherapy. You didn't mention urogynecologist. You mentioned referral involved. Your senior you mentioned, and GP. You did you mention?
No, ma'am. No.
Yeah, because GP I didn't hear, physiotherapist I didn't hear. You involved your consultant and urogynecologist. Communication with patient and families. Discuss the possible causes of leakage of urine. Explain the investigation and management plans. Discuss long-term implication. You discussed. Ascertain her anxieties. Addresses them. Offer pelvic floor exercises. You mentioned one only sentence. Dear, here actually you have to emphasize on PFMT, pelvic floor muscle exercises. Counsel on early symptoms of infection. Okay, you are counseled. You had mentioned. Okay, educate patient on catheter care if you go home with one. So you had educated me. Okay, and this is bladder and bowel community. There are certain communities or certain support groups you need to know thoroughly. This is one of the common group you need to know thoroughly. Okay, that is my opinion. Please ensure that you will be saying that.
Okay, ma'am. Ma'am, I have one doubt, ma'am.
Yes, dear.
Ma'am, if she asks why am I leaking? What do you have to tell, ma'am? Just because it is because of this.
Yes. Yeah. So it is because of this postpartum voiding dysfunction where the function of the bladder, the tone of the bladder is uh, means what we can say because the tissues around the bladder, the muscles around the bladder get weakened and they are not able to function the way they used to be. Okay,
Okay,
and that's the reason they are getting you are getting this uh, retention and along with that leak. Yeah,
okay, ma'am. Yes, ma'am.
it's basically it is SUI also you can mention. So these are basically associated with this. So if it is SUI also, stress urinary incontinence, it is because of the trauma to the pelvic tissues, pelvic trauma. So because of this, it is because of the birth trauma. Okay, birth trauma because of the instrumentation, and effective pelvic floor muscle exercises is the treatment of choice. We all know that. Yes, dear.
Yes, ma'am.
Okay. Anybody is having any question? Shall I stop the recording? Nobody? Okay, dear. Thank you. Today